This is the Whole Care Network. Helping you tell your story one podcast at a time. Content presented in the following podcast is for information purposes only. Views and opinions expressed in this podcast are solely those of the host and guest and may not represent the views and opinions of the Whole Care Network. Always consult with your physician for any medical advice, and always consult with your attorney for any legal advice. And thank you for listening to the Whole Care Network.
Welcome to From Guilt to Good, Self-Care Solutions for Busy Caregivers, the podcast rewriting the narrative of self-care. If you're a caregiver feeling stretched thin, torn between responsibilities, and longing for self-care, then you are in the right place. I'm Jeanette Yates, fellow caregiver, and someone who has spent years doing all the self-care things and never really feeling any better. After years of research, self-exploration, and trial and error, I finally found a way to create a sustainable self-care practice that made me feel good, not guilty. And in today's episode, we are welcoming back my lifelong friend and licensed mental health counselor, Angela Turke, for another conversation about learning to address our own needs even as we care for others. And if you haven't listened to the first episode with Angela, check out the description or the show notes. I'll make sure to link it there. But today we're going to really dive into, in the last episode, you talked with us about, okay, I want everybody to tap into their inner intuition and become more self-aware, which is, I think, very important. But to your point, sometimes that's not accessible to us. We can't yet even become self-aware. There's lots of different reasons why. So you advocate for just do it. Just, that you're going to need food. That you need sleep. That you need water. Do those things. Put yourself on a schedule like you put your infants on a schedule, like you put your animals on a schedule. You just have to do it. So sometimes we can't wait for ourselves to feel tired, or especially when you're always tired, or when you feel hungry because you may either always be hungry or never hungry, things like that. And you just may not be able to tap in to those feelings at all. You've completely tuned them out so long that maybe they're still there. Maybe your body is still trying to talk to you, but also maybe it's not. And so in today's episode, we really want to dive deeper into, obviously that's not a sustainable situation. If we can't listen to what our body needs then that's going to be a problem in the long term. Which brings me to why I really wanted to have you on, which is the idea of how do we get help with that? What are some options that are out there in the world of the mental health space, the therapy space, that may be able to help us with that? So I want you to talk a little bit about that today, and you can start wherever you want to start with that.
So, I was thinking a couple of things. One, linking back to the previous episode where we talked about, being able to identify your basic needs. Sometimes we, our body stops communicating some of that to us. So if that's the case, then we may be a little lost as to what we're supposed to be doing. Mm-hmm. So putting in that schedule, for eating, sleeping, meds, that sort of thing, may make a difference in our mood and our body being able to communicate with us again, maybe where it hasn't been in the past, for some time. But also, I wanted to talk a little bit about how sometimes our mood can take control of our behavior too. So, or we allow that to happen.
Right.
So, because I think you mentioned like always feeling tired. Well, if we always go to sleep when we feel tired, then maybe we're sleeping more than we should be.
Right.
You know, we're not, and then we're feeling guilty because we're not getting enough done because we're sleeping too much. But then we're like, well, but my body told me to sleep. Well, but did it? You know, this is where. So
there's can be other reasons you're tired besides that you need more sleep. There's other things that could be going on that, you know, may be into play too, which probably is not not where you wanted to go. But like, I think about that too.
No,
like,
that is where I was thinking things like depression and compassion fatigue, and you know, if you're
thyroid disease.
And well, yes, there could also be the medical issues that could be causing that. But there's a lot that I mean, it's exhausting being a caregiver,
right?
And for anybody, you know, I mean, it's exhausting being, you know, a mom with young children and not sleeping. It's exhausting being, you know, a caregiver on top of that. It's a lot. So of course one might be more tired.
Right.
So of course you might want to take more naps, but then also the to-do list doesn't get any shorter.
Right.
so then, you know, trying to figure out how to balance that, and, you know, do I listen to my body and sleep when it's telling me to, or is my body disordered at this point and I'm depressed and it's telling me to sleep more than I actually need to.
Right.
You know, so and in that case, that's where the schedule may help some too.
Right.
And, you know, and that's where maybe some professional help might help you tease out what's going on, you know, and rule out whether it is just exhaustion, or whether maybe you are having some depression going on, or maybe you follow up with a primary care doctor, or, you know, get some blood work done, or whatever, right? You know, because there could be multiple things at play, because So like, let's say we've put ourselves on a schedule because we know, like, we're not sleeping enough. We already know we're not sleeping enough. We're not eating, you know, enough, probably, chances are. Because even if you're eating, we've talked about this offline too. Like, even if you're like, oh, I eat so much, my diet's crap, or, you know, like, you're like, yeah, but if you're not eating food that's nourishing your body, then it doesn't matter how much it is, really, like, if you're not getting the nutrients. So there could be problems there. But let's assume that you know, you put yourself on a schedule, you're eating, sleeping, drinking water, and you're still having either physical symptoms, or you're still exhausted, or you're still doing these things. Right. You know, then you can say, okay, let's go check in on some of these things. Let's go to the medical doctor. Let's have some, you know, of the basic, you know, we go back to that word basic. Let's just have some of the basic blood work done. And I know that seems, you know, this is one of the things that we get into as caregivers. It's like, I don't have time to go to the doctor because I'm taking my person to the doctor. And like, I feel like you would say this, because I feel like this is also what you've said to me over the past 40 years of our friendship, is you need to do it. Like, period. Like, go to the doctor. Yeah, because if you're not taking care of yourself, then you can't provide the proper care for the person that you're caring for. And you also can't just like live your life. Like, you can't even when you're not caregiving, if your energy level is not where it should be, then you're not feeling well enough to maybe do some of the things that you could be doing when you're not caregiving. Right. So it's worth taking the time. Yeah, it is. Well, I shouldn't say taking. I should say making. That's right. You know me. Yeah, you are going. Yeah, no, you're not going to find it. Not going to find the time. No one's going to give it to you. You're either going to have to make it or take it, because it's, you know, you're going to have to do it. But one of the things, so this is what happens when we do go to the doctor, and then it does appear that, like, and maybe even we're even aware of it. We go to the doctor and we say, I think I probably need to go talk to somebody. You know, I think I need to go. And then they give you this like list that means nothing.
Like, here are the people. And then you have to try to figure out, based on the letters behind someone's name and maybe their little bio, whether or not this person can help you when your situation is unique. It's different than your typical, like, you know, I know that I have struggled with depression and generalized anxiety disorder and all, and a whole other, I have a whole host of things we could talk about. But the point is, like, depending on what my specific situation was calling for at the time, I needed different types of specialties. And so one of the things I think would be very helpful for caregivers listening and watching is for you to just talk a little bit about, like, when people hear the word therapy, some people think like it's all, every therapist, like it's all the same thing. They may have this image of like the Freud, you know, or like laying on the couch with somebody scribbling notes in a little notepad or something like that, or something very confrontational or something they saw on, like, you know, an episode of, you know, ER back in the day, or, you know,
Right.
you know what I mean? Like, tell us a little bit about, like, what does therapy mean? And then just give us like a general idea. And for everybody who's like thinking, oh, I need to take notes here, I will have something in the description or the show notes that you can download that just has your basic, like, definitions. And then we'll give you some other resources as well, that you can access. Okay. Hit it, girl.
Okay. So basically, I think the most important thing is to find a therapist that you connect with.
Yes.
Because just because one person does it one way doesn't mean a different therapist is going to do it the same way.
Right.
Or even if two different therapists are using the same modalities, they're still different people.
Right.
So you may connect with them in a different way, even if they're using the same treatment modality.
Right.
So you know, just, I think if you have an EAP available, like if you're working and you have an EAP, you can.
And so what does that mean? What is EAP?
The EAP is an employee assistance program.
Okay, gotcha.
And basically, if you contact them, they usually have somebody that kind of listens to what your issue is, and then we'll try and match you to a therapist that can help you with that issue.
Got you.
So, and usually they have a pretty quick turnaround time for that as well. So, so it's helpful, you know, to be able to say, okay, what I want to work on in therapy is,
right.
you know, I'm grieving the loss of so-and-so, or I am caregiving and I'm overwhelmed and I'm working and I'm parenting and I just really want to learn more how to manage my time and care for myself.
Right.
So, you know, even when you call a therapy practice, like, how, you know, when you talk to the person when you call, and they know the therapist in the group.
Right.
I mean, they really usually know, okay, based on what you said, you know, I think you'd be a good fit for so-and-so. So, and maybe they're right, maybe they're wrong. You'll find out, you know, if you meet with them and you don't seem to click with them, then, you know, there's plenty of other therapists.
Right.
So I think my first big point of advice is don't write off therapy as a whole just because you don't connect with a therapist.
Right. Or because the therapist in 1992 that you had, you didn't like, for example, like, maybe give it another shot.
Yeah. And you're not necessarily going to feel better, you know, immediately. Like it takes, you know, initially you're probably going to talk about all the things that got you to be sitting in that chair. So why are you here?
Right.
So and usually that's more than a sentence. So it's going to take a while for you to explain all the reasons that you're there. And so after the first session, I mean, you may not accomplish a whole lot except for, you know, getting some background information, you know, and then figuring out what kind of goals you want to work on, and then how do we get there?
Right.
So
yeah. And I wanted to say too, that like you said, the first session is typically just like information. Tell me a little bit about this. Sometimes you get into, especially if it isn't your first rodeo, like when it's like, okay, where do you want me to start? But I think also one of the things that does happen, if you're ready for it, if you're able to do it, is being able to just know that the space that you're in is safe. Mm-hmm. You can say all the things that you feel guilty, like you think are wrong, or you think are, like you're not supposed to say, or whatever. Like you can just say all those things, and a therapist that's been trained properly is going to be able to receive that for what it is. And it's a safe space, it's a non-judgmental space, and so sometimes just having that catharsis,
right,
or that sometimes validation,
just being able to talk about what you're dealing with without, other family members saying, well, you should, and give you another whole laundry list of things to do, is really is helpful to just be able to vent for a bit, and then come up with some strategies that are really going to help make your life more like you would like it to look. And for every person, that's going to be different, as to what your goals are.
Right.
So,
and maybe just even knowing what your goal is hard.
Right.
Like that may take some time, and your goals may change too. But you have to start somewhere, and it's okay to say, like, I remember, the therapist I'm seeing now, love her. I remember saying, this is why I'm here, to be able to be a better caregiver, and what I thought that meant at the time. And my goals have changed. The result is the same. I feel like I am, able to be a more present caregiver, a more, receptive caregiver, things like that. But the way I thought it was going to work and the way it worked are two totally different things. And so, it's okay to not be 100% sure what your goal is, other than like, I just know that I need something to change. Like I need something.
Right. Then we talk about how things are now, what you would like it to look like, what changes you're willing to make, what changes you're not willing to make, that, and it could be baby steps, and then it could be massive life-changing. It depends.
Well, and I think too, another thing that people, not just caregivers, but anybody going into therapy, because I've been in therapy as a caregiver, I've been in therapy as someone in recovery. It's like, I know things need to change, but also like, if I could just do it, I would have just done it already. Like I'm afraid, I'm scared. I can't say no, or I can't, get past this. Well, that's what therapy is for.
Right.
So things that you don't think are possible now, with the help of a therapist, a trained, licensed therapist, you can get closer to that reality, or perhaps even be able to get there. So there are things that I never thought were possible in my life that were so far out of my comfort zone. I was like, are you kidding? Like, do that or don't do that. It's like, what? Never. And now it's something that is possible, but never in the course. And for some people, like my therapy experience is different than, everybody's therapy experience is different. But I know that for me, it wasn't about going, from the side of the pool all the way to the deep end of the ocean, right? It was baby steps into uncomfortable but manageable situations or circumstances to help me get to the deep end of the ocean that I wanted to be in, let's say. So like it, there is an element of discomfort usually, but hopefully you're not, being plunged beneath your
No,
depths
no.
of ability.
It should be learning some new skills, trying those new skills, seeing what happens from that,
Right.
you know,
And then adjusting.
talking through that, because, you know, it may have caused more discomfort, because the reality is, I mean, a lot of what we do, and for as caregivers, et cetera, is we have to figure out where the boundaries are.
Mm-hmm.
You know, where our time is our time, and
Right.
when shared, and how to draw the line in there, and what's okay and what's not okay. And it's very hard to figure out. And so, you know, and if we're setting a new boundary, then that's new for us, but it's also new for the person that we're setting the boundary with.
Right.
So it's going to be uncomfortable for us to say, you know what, I'm not going to be able to do this.
Right.
Then they're going to have a reaction to that.
Right.
And so,
and part of learning is like, okay, anticipate, like, we know that this reaction is going to come. We don't always know exactly what it is, but sometimes we do. And learning some skills to be able to,
on how we handle that.
Yeah. Because you know, one of the biggest things that you've got to learn, and this is something I talk about when I work with caregivers about boundaries, is like, you cannot set that boundary and expect everyone else to hop to about your boundary. No. It's not their problem. It's not their, like, it's your responsibility to hold the boundary. And that means that when somebody doesn't honor it, whether it's intentional or not intentional, maybe it's just habitual for them because, you know, they've always done it this way. You have to be like, what are you going to do? So what are your steps that you're going to take? So I want to move into, and of course, I don't even know how many therapy modalities, treatment modalities there are out there, but I'm sure we don't have time in an episode to talk about all of them.
No, and I'm just gonna say that most people, most therapists, most people are using cognitive behavioral therapy,
right?
And that is when, you know we have a behavior we want to work on, and how do we deal with that? Like,
right.
What do we do to change it? I mean, it seems that's really the most common thing that people use.
Right. Well, and I also want to say too, though, you have talked to me before about, like, typically a therapist is trained in many modalities of treatment. Yeah.
Yes.
And so when you go to a therapist, unless they just happen to, like, only want to use one, is it something that, like, maybe a therapist would use multiple modalities with a singular? Okay.
Most do. And some of it's going to depend on the issue and the personality of the person that you're working with, and, you know, what the needs are. And I mean, we're constantly assessing.
Right.
So
now I know that with, I'm very curious. So I always, like, probably ask too many, like, ask more than, like, the normal patient when, you know, when I'm with my therapist, but, you know, I always know what we're working with. So I know when we're doing, you know, a cognitive behavioral therapy, or another therapy that's grown in popularity over the last several years is the EMDR, which, if you know anything about that, I would love for you to talk just a little bit about what that is. And so I know that, but do therapists typically tell their clients or their patients, like, or ask them, or do they just kind of move in and out? I know with EMDR it's kind of different because you kind of have to know what you're going into. Yeah, that's what
I was going to say. That is definitely different because you have to do a whole assessment for EMDR, you know, ahead of time, and it's a specialized therapy.
So with So with the therapy like CBT, which is cognitive behavioral therapy, that's like a talk therapy model that is just, you know, the therapist is using these strategies or using this method, but to the patient, to the person doing it, they're talking and listening and responding and going back and forth. Are there other talk forms like that that might be being used? Or do you, like in your experience, I know you've been a therapist for a long time. So, like you said, in your experience, most people are doing CBT with their
most people,
mm-hmm.
because most people,
there's typically something that they want to change, a behavior, and especially in your field where you're working with the people who are trying to break free from an actual behavior, like addictive behavior. So that is definitely something that's very popular in that space. I just thought of another episode that we need to do, which is I would love to maybe compare and contrast addiction behavior, some of the characteristics of addiction and how that might, how caregivers might be having some of that. I wouldn't call it an addiction, but almost that codependency type of.
Yeah. I would love to talk about the family systems
yes.
and the roles in the family that happen in the addictive family, because the same thing happens.
Right.
It's really it's really from they would just say the dysfunctional family,
right.
which would include addiction,
right.
but it would also include mental health, and some of the same stuff happens with, physical disabilities,
right.
and when we're caregiving, because there's more things on our plate,
right.
and then we drop the ball on some other things,
right.
and there's going to be.
So stay tuned for a third episode coming soon to the From Guilt to Good podcast, because that is a whole, I think that's another dynamic worth diving into. But for today's purposes, for the most part, you're going to be dealing with some sort of talk therapy. But EMDR, I just want to hit on this before we end for today. EMDR might be something that some people encounter when they're like reading the little bios of the therapist that they're trying to pick from. They're like looking and they see, EMDR therapy. Kind of just give us a Reader's Digest version of like, what do those letters stand for? And like, how is the EMDR therapy used, and why might a caregiver want to potentially deal with it? Or why might somebody who is having trouble listening to themselves and connecting with, to go back to our original point, is like using therapy to get back to really be able to listen to ourselves, listen to our bodies. Why might somebody maybe want to explore EMDR?
So EMDR is eye movement desensitization reprocessing. I'm not an EMDR therapist. It's specific for reprocessing trauma, mm-hmm. but it's not just, and when we think of trauma, we may think of like, being at war, or, witnessing some, huge tragic or traumatic event, or some sort of like one-time thing that we would need to, that we might be having flashbacks or PTSD or something like that from. But that is not the only way to think of trauma. So,
right.
So EMDR is very helpful for multiple types of trauma, and there's many therapists that specialize in it. So I think that, and sometimes when folks have suffered trauma, they do have a harder time than connecting, mm-hmm. With recognizing some of those internal signals, right.
Right.
Back to talking about whether we're hungry or whatever's going on with our bodies, we may need some assistance with that. Yeah. So EMDR is really, really helpful, specific type of therapy,
right.
For dealing with trauma.
So to learn more about the different types of therapy, like I said, we highly recommend, or I do, and you can make your own recommendations, Angela, that like you go to your primary care doctor, your general practitioner, and you just say, hey, I want to know more about this. That's a great way to get the ball rolling, to get some resources. And sometimes they do better than just hand you a sheet of paper that has a list of therapists. Sometimes they actually will listen and like listen to what your needs are and direct you accordingly. But that would be my first suggestion, is that you do that. And then like you also mentioned the employee, what did you call it?
The employee assistance program. Yeah. If you're working, you should be able to call your employee assistance program, because they can also connect you with a therapist. And usually what's great about that is there's no copay associated with that for the first however many sessions. It's usually like 5 or 6. And then you can also call your insurance company, and they can tell you who's in network with your insurance company so that you can, connect with a therapist that way.
Are there any, so, and also, again, if you look in the description and you look in the show notes, I will put some hotline numbers for, mental health and things like that so that you can access, different resources. Of course, you can also reach out to your local, hospitals and like we said, doctor's office and different places that are in your local area to access community, resources. So I know that one of the issues that we just didn't have time to talk about today, but I do want to acknowledge that, of course, therapy is not always accessible financially. And so, I do want to acknowledge that and say that there are some social services available in many areas. And so I will try to link as much as I can in the show notes in the description without it being like, a whole essay. But just know that, there are things available, even if it is just starting with your primary care. It is okay to ask for help. Caregivers do not like to do that. It is uncomfortable, but it is okay to do that. And I know that for me, working with caregivers, being a caregiver myself, I know that when I started voicing my own needs, I was able to access more support and resources. So I think just being able to acknowledge that you need either food, sleep, water, or therapy is the first step in being able to see what is out there and what's available. Angela, do you have anything else you want to say to our listeners before we sign off for today?
Just know there's a lot of resources out there, and if therapy doesn't seem to be working, obviously the therapist may make some additional recommendations too. If they're, for medication management, so might the primary care, if that's something that's necessary. So there's multiple ways it can go, but I think it's just important to consider some professional options.
Yes.
So you can continue to do what you're doing.
Yeah, that's right. That's right. We gotta
in a way that feels, in a way that feels more hopeful and stable and secure.
Right.
That's
we don't want to be hanging on by a thread for.
Right.
Yeah. That's not what our loved ones want, really, even though sometimes they act like, like sometimes we may feel that like that's what it, but like that's not what they want, right? They want us to live full lives, to live lives that have joy in them and that are not burning it all down, nonstop. Mm-hmm. Well, Angela, thank you so much for joining me today. And we will have you back on because like I said, we just opened up a can of worms and now we'll have to have you back on to talk more about, some of the stuff you mentioned, family systems, how that all works together. I do appreciate you giving your time today. And, of course, for those of you listening and watching, thank you for joining me today. From Guilt to Good Podcast is a proud member of the Whole Care Podcast Network. To access additional self-care resources and the resources we discussed in today's episode, head to the show notes or the description. We will have all of the stuff there. And remember to subscribe now so that you can join me in going from guilt to good and rediscover your worth, reclaim your health, and get back the life that you've been too busy or exhausted to enjoy. And if you've enjoyed this show, please take a moment to leave us a review. Your feedback matters. We are redefining self-care for caregivers one episode at a time. And until next time, remember, you are worthy of the same care you give others.
This is the Whole Care Network. helping you tell your story one podcast at a time.